Gabby, come here real quick. So my knee hurts really bad. I banged it up pretty good this morning. Google says I have a hematoma forming because I'm bleeding so much. It could be hemorrhaging. I looked it up and it says that erythematous is a sign of infection. I think I'm gonna need a below the knee amputation.
No, Mom, stop being such a hypochondriac. Let's take you to the doctors.
1 hour later.
Susan, you guys can follow me back to the exam room. Just head on right in there. Hi, my name's JC. I'm gonna be your nurse today. What brought you guys in?
My mom hit her knee on the car door and she thinks she needs a below the knee amputation, but I don't think so. Could you check her out for me?
Of course. I'm gonna start by just checking your vitals. I'm gonna use the stethoscope to check your heart and lung sounds, and then I'm gonna use a sphygmomanometer to check your blood pressure. Would you mind taking a deep breath for me? And then one more. Perfect, thank you. Is there any other history that you want me to know about?
She has a history of arthritis, and in the past we've visited an orthopedic surgeon for arthrodesis.
Okay, I'm gonna go grab the orthopedist and she will be right in with you. When I checked her out, she was overall in good spirits and doing pretty well. I did notice a little bit of edema in her left knee. Her vital signs were all within normal limits, except her blood pressure was a little bit elevated, but it was only the systolic number. So I'm assuming that was just because of the stress of the incident, because no history of hypertension was noted. Her heart rate and respiratory rate were both normal. She complained of limited range of motion and a little bit of pain with pressure and palpation, but other than that, she seems to be doing okay. Okay, I'll check her out.
Hi guys, I'm Dr. Haley. I'm just gonna check you out. If you wouldn't mind laying prostrate for me real quick. I'm just gonna look at your knee, see what's going on. I don't think you need an x-ray. I'm just gonna prescribe you some antibiotic cream for your laceration and a brace to stabilize your knee. I have no reason to suspect a fracture, and you definitely don't need an amputation.
See, Mom, I knew you were worried for nothing.